Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Well, hey, everyone. Welcome back to the TechLink Health Podcast. I'm Dr. Sarah Saman, and my guest today is Dr. Kevin Smith. In this ever-evolving and rapidly changing healthcare space, innovations in technology are often the primary focus of breakthroughs in achieving optimal outcomes. And while deep tech will continue to play an increasingly important role in achieving efficiencies alongside outcomes, it's also important to highlight the hands-on innovations that are crafted by clinicians through their many years of experience and creative energy, propelled by a desire to transform lives. In theory, when it comes to deep tech like AI, technologists are attempting to replicate human behavior in the processing of certain tasks, with the promised upside of allowing people to perform more complex and higher value tasks. And that ultimately leads to expanding the innovation curve. In today's episode of the TechLink Health Podcast, we discuss this process of innovation as it relates to breakthroughs in surgical procedures, particularly focused on nasal abnormalities and the connection to migraines, as well as other common health conditions. So, this particular breakthrough is told through the story of Dr. Kevin Smith. He's a facial plastic surgeon, ENT surgeon, and the creator of the revolutionary surgical procedure to treat migraines. At the heart of Dr. Smith's practice is a groundbreaking procedure targeting the root cause of migraines, a deviated septum. And through meticulous evaluation and treatment, Dr. Smith has achieved an impressive success rate with over 4,000 procedures performed and a remarkable 90% of patients experiencing significant relief. So Kevin's approach goes beyond symptom management. He's dedicated to unraveling the intricate connections between migraines and underlying nasal abnormality. His research and his case reports have shed light on the profound impact of nasal surgery, not only on migraines, but on a potential connection between migraines and neurological symptoms and disorders as diverse as multiple sclerosis, Parkinson's disease, and Asperger's syndrome. So it goes without saying that Dr. Smith has a passion for creative breakthroughs that will help people to live a better and healthier life. And we look forward to getting his perspectives on the podcast. So without further delay, we're excited to welcome Dr. Kevin Smith to the podcast. Dr. Smith, thank you for joining us today.
Thank you very much for having me, and I want to congratulate TechLink Health for having such a topic like this on their podcast.
Well, thank you. Your story is a refreshing one, particularly in this era, which is heavily focused on technological innovation. And we'll get to the story which led to the breakthrough surgical procedure. But to start and to give our listeners some more background, can you take a moment to introduce yourself in a bit more detail and tell us about your journey in the surgical space?
Sure can. I attended the University of Michigan, Go Blue. We won the national championship, and I had a football scholarship to play at Michigan. Very fortunate there. Went on to the University of Texas Medical School in Houston, where I completed my medical school training and also my otolaryngology or ENT residency. From there, I did a one-year fellowship in Alabama in facial plastic surgery. And then I came back to Houston, set up my practice right there in the heart of the largest medical center in the world, the University of Texas Health Science Center. And I practiced there, both ear, nose, and throat and facial plastic surgery for about 17 years until I moved my practice more out into the community. So a total, I've been practicing about 30 years, and it's been a very, very rewarding practice. And I say practice because in my office, I actually took heed of practicing medicine, but then taking note of the results that I was getting. And that's what led to this remarkable discovery that there's a link between the nose and migraine headaches and severe chronic
Well, it's very interesting to hear about your journey in the ENT space. And that makes me even more interested in connecting the dots to your breakthrough surgical procedure to treat migraines. So let's dig a little deeper into that story. Can you walk us through the creative journey that led to the breakthrough and give us more details on the proof points that you've observed over time?
Certainly. As an ear, nose, and throat surgeon, I was performing lots of sinus surgery, nasal surgeries, and pretty good number of them would have these headaches. And so I would do the procedure and observe that the headaches would go away. Some patients came back and they were ecstatic that, gosh, Dr. Smith, I've had these headaches for 30 years and you got rid of them. But then after a while, I started looking at my data and it showed that over 90% of those people that came to see me had a history of migraine. So now I'm at a point where I'm perplexed. I'm thinking, okay, these have histories of migraines, but I'm helping them out with a nasal surgery. So these must be, let's call them migraine imposters. So I said, these are some very severe headaches. They act like migraine. I would call them migraine like headaches because, as you know, a patient with migraines considers themselves very different from a patient with chronic headache. So I had to link the two somehow by adding migraine like, migraine type, migraine imposters to the vernacular. And I want to make one point. It's more than just a deviated septum. I know that a deviated septum might be the most common abnormality that I find, but you can have abnormalities with the turbinates, which are the air filters of the nose. And you can also have problems with the sinus cavities themselves. So it could be those three things in combination or alone that might need to be treated. And what I do is I actually make a customized procedure based on what I see on the CT sinus scan. But I started looking at the numbers. I was perplexed. I called them migraine imposters. And then finally, one day I was on the doctors and I said on the television show, I said, you can have access to my expertise by getting a sinus scan, send me the disc, I'll review it, and I'll let you know if you're a candidate for my procedure. So I get these scans from all over the country. And lo and behold, nearly 100% of those scans had the abnormalities that I knew caused the severe headache and migraine imposters at that time that I was fixing. And that's when I took a deep breath and I said, you can't ignore these numbers. I'm actually curing migraine headaches. Based on this large amount of scans that I'm getting, I'm curing migraine headaches. So after that, I then started taking the marching orders and taking my flag and saying, I eliminate these migraines. And based on what I saw in my practice, I was eliminating migraines of all type. They aren't just sinus migraines or sinus headache. They're hormonal migraines. They're hereditary migraines where I've helped families with migraines. There are people with hemiplegic migraines that act like a stroke and they have all these other neurological symptoms that accompany them. Complex migraines, cluster headaches, which are known as suicide headaches because they're so severe. And that's what it's come to be now. I now know that the root cause, and I'm a big root cause guy. When you think about the human body, it's made very logically and you have to really understand it. I have students that rotate through my office all the time, and I tell them it's very important that you have to understand not only the anatomy, but the function of that anatomy. And if that anatomy is altered, you have to understand what the ramifications of the altering of the normal state would be. And that's what got me to this point where I am today.
That is fascinating and interesting that your innovation challenges the conventional thinking when it comes to treating migraines. It's definitely outside of the way that most of us were taught about migraines and the way that most migraine patients are treated. So, given the promise of this breakthrough, tell us about the potential next steps and how this innovation can be scaled among other practitioners.
You made a very good point. We were both taught that migraines are in the brain, and it's important to understand that 95% of all brain scans done on migraine patients are absolutely normal. Only 5% will find an abscess or meningitis or a tumor or something of that nature that might explain a severe headache. So these people have these normal brain scans, but then the opposite is true when you look at sinus scan. And when you look at migraines, it's really, in its simplest form, it's head pain. And the head is comprised of the brain, the sinuses, the eyeballs, the nose, the mouth, the teeth, the jawbone. And then sometimes the neck can also refer pain to the head. So you're shortchanging yourself if you're going to evaluate somebody with head pain by just getting a brain scan. And that's evident by the statistic that I just told you. But when you look at the nose is protruding from the face. It's very sensitive. I think the best way to describe it is that if you've ever had one of the original COVID swab tests that they went back as far as they could to get a good sample, those tests hurt, and they didn't stop hurting until they removed the swab. So what I'm doing with my procedure that I call the Smith sinus migraine technique is I am normalizing an abnormal nose. I'm not doing anything abnormal. I'm not cutting a nerve. I'm not implanting an electrode. I'm not doing any of those things. I'm taking a nose that is abnormal and I'm making it normal, because normal noses don't cause migraines and chronic headache. So how do we scale it? Well, this is something that's going to be on my agenda for the rest of my life. It's very important. One, I'm looking for the perfect investor. And I have some key people in mind. In Texas, we have Michael Dell, who has a medical school. We have Tillman Petita with a medical school. You have people like the Gates Foundation, Melinda Gates, and then just a host of other people that I've kind of pinned and said, these would be the ideal people that I would like to work with. Because I can have the technology and the innovation, but you also have to have the resources to execute it in a manner that you need to. And let's look at the numbers. There are 40 million people in the United States with migraines that could benefit from what I have to offer. But in the world, there are 1 billion people. And so this is needed everywhere. And so it's going to take a lot of resources for me to, one, train other surgeons first. They have to be trained in my technique. I've had patients come to me who have had 2 and 3 prior sinus surgeries, prior septoplasties, prior balloon sinuplasties that still had migraines. Or in one case, I remember one lady never had migraines until she had her nasal procedure and ended up having migraines for 23 years until she found me. So it goes to show you how sensitive the nose is. And we as ENTs have to understand that it's a very sensitive structure. It needs to be handled very daintily. And my procedure is very intricate. It's very detailed. It's highly specialized. It is a septoplasty. It is turbinate reduction surgery. It is that. But it's performed in a way that's highly specialized so that it can eliminate these migraines at the 90% success rate that I have. So yes, so to grow it, I'll have to train surgeons. I'll have to develop software that can help train the surgeons and track the success rate. Then I'll step back and be more of the quality control person that actually looks over everything. But then there's the need for writing the case reports to establish the foundation, doing the research, more research in the different categories of migraine, the cluster headaches, and just slowly converting the medical community over to understand that these migraines can be eliminated with nasal surgery when done the proper way. Yeah, so that's the task that I have before me, and I'm eagerly looking forward to making a dent in that task, a great one, but I think it can be achieved with the right team and the right approach.
That's really exciting. And to think of how many lives can be positively impacted through the work that you do is really incredible. So one of the areas that you have special interest in is neurological conditions such as multiple sclerosis and Asperger's. And I'm curious how your procedures and your technique might work within those areas.
That's a very good question, because just when I thought migraines were enough, I observed some other things in my patient. So particularly one patient who had the hemiplegic migraine. She'd have her migraine. She would have blackout. She would have paralysis of her legs where she could not walk, tingling in her leg. She would have slurred speech, temporary blindness, tremors and things. And that's just one patient. But I do see other patients that stutter when they have their migraines. They have these tremors with their migraines. They have these pseudo seizures. They have the tingling of the arms and legs. They have the numbness of the arms and legs. They have the partial paralysis, the blindness, the slurred speech, the word garble, the mental confusion. They have the word search where they can't find the word to say. And so I see all these things, and when I do my procedure, these things go away. Now, that caused me a big pause. I'm like, okay, now what is going on here? And there's a condition called cortical depression in the brain. And the way I like to explain it is you can see one single lightning bolt can hit a tree, and you'll see that. But you can also look up in the sky and you'll see the lightning spread out and just get really diffuse. And my thinking is when the pain fibers from the nose go to the brain, they're hitting these other nerves really diffusely. And then some people, they'll get tingling. Some people will get the surge speech. Some people get the eye symptoms. I've even had some patients have abdominal cramping and constipation that have gone away after my procedure. And I think it's because the body is made of nerves, first and foremost. And if you have an abnormal trigger in the nose that's constantly firing, constantly keeping you in the fight or flight mode, then something's got to give. Some people have nothing, but those people that have all these neurological symptoms that go along with their migraine, it's just incredible to see that these things go away. So what I did with 3 of my patients with the hemiplegic migraines, I compiled a list of the top 20 Parkinson's symptoms. And I took them in a room and I just said, I'm going to ask you these symptoms. Did you ever have these with your migraine? And I didn't tell them what they were. And so I just asked the question and made a check mark. And one lady had 60% of the most common Parkinson's symptom when she had her migraine. Another had 65 and another had 70%. And so when I told them afterwards, one guy said, and I hadn't even thought this far, one guy said, do you mean to tell me I was on my way to getting Parkinson's? And so I stepped back, I listened to my patient, remember, listen to your patient. And I said, if you have 70% of the Parkinson's symptoms, I'm sure at some point, some neurologist might diagnose you with Parkinson's. I hadn't thought about that. And then I started reading where migraines are related to at least 75 neurological disorders: MS, Parkinson's, Alzheimer's, Tourette, autism, ADHD, irritable bowel, Crohn's disease, retinitis pigmentosa, and the list goes on. So the question is, what's that association? Is it the nose? I don't know. But that's an area I need to research because I see so many people with these other neurological symptoms that go away. And so it might be the link. Who knows? So that's where I stand now. I've got a lot of research to do.
Yeah. Fascinating. Really, really interesting area of research and study. And I think you also mentioned Asperger's, and that's
Yes.
an area I think that
Yep. That's
where,
one of them too. I
yeah,
had a patient with Asperger's who came to see me, had the abnormalities. He went through the surgery and he was able to work after I took care of him. Of course, with neuroplasticity, once things are ingrained, certain things are ingrained. And I would never claim that I could reverse something like that. But he was able to work and he was more verbal. And I did have one MS patient who she had these episodic MS episodes and along with migraines. So she had her procedure done and she would get this foot drop every time she would have her MS episode. And since her procedure, she has had no migraine, no MS episode with the foot drop. So
very interesting. So
yeah,
I'm sure
it's
something,
fascinating.
yeah, I'm sure we'll be hearing more about this as time goes on, and we learn more from more patients. So really an area that I think is something to pay attention to.
It is. And another thought that I had too, I just called one of my professors who developed the mobile stroke units here in Houston. And because it hit me again, okay, if you can have hemiplegic migraines that resemble a stroke, then I wonder what the incidence of people who have been told they have a TIA or a mini stroke actually have a hemiplegic migraine. I think those people need to have their noses scanned because there's a big difference between walking around saying, I had a stroke in the past, and you have a hemiplegic migraine that Dr. Smith can cure. There's a big difference. So, because those people, of course, when they come in and with these symptoms, the brain scan will be normal. When I ask people who say they had a TIA or a mini stroke, I said, okay, what did they see on the brain scan? And when they pause and go, well, they didn't, I need to hear a clot or a bleed. Tell me what you had. Of course, you could have a little fleck of the carotid artery embolism go up there too, but that's what I'm looking to hear. And if I don't hear that, I think those people need to be scanned with a sinus scan to see if they have the abnormalities that I know cause hemiplegic migraines.
And for something that's safe and non-invasive, it seems like an easy answer, something that, an easy thing to work up, an easy
It
thing
is.
to
It,
include.
this the CT scan of the sinuses is very, very instrumental, and it's a gold standard in my office as far as a diagnostic tool. And the procedure that I do, we didn't talk about the procedure that I do. It is covered by insurance. It takes about an hour. It's done under general anesthesia, and it's a day surgery procedure. You go home the same day, and it's 90% effective. Most people will have discomfort the first 2 days, and then they'll take Tylenol for the rest of the time, and they're doing pretty good. So it's a pretty effective and fairly quick procedure. You have people from all over the country just fly in. You stay here in Houston for a week and get it done and go on about your business.
Fantastic. Well, thank you so much for sharing those insights with us. That's really exciting. And to think of how many lives can be positively impacted through the work that you do is really incredible. So in the past on the podcast, we've often started conversations around health equity, and this gets to that idea of being able to scale the procedure and how technology, when designed the right way, can help bridge that gap. So a part of this equitable by design approach requires input that account for diverse data sets and clinical expertise. So, a range of different kinds of people and different places of practice and different varieties of practice. So, tell us more about how diverse lines of thinking and creative energy can continue to unlock future value within healthcare and life sciences, and in particular, how that relates to the surgical technique that you've developed.
Well, I think it's very important that we have diverse ways of thinking, people who think outside the box. And if you're me, my response is, I don't know what a box is. So that's where my stance is. But when you have like minds who think that way, I think it's very important that those minds get together and share their ideas. Then you have to have, again, like I said, you have to have the resources and the backing to help implement the ideas that you have, or the people that you can convince to come on board to assist you in that. But yeah, the exchange of ideas is very important. And to have that come from different people and from different groups is also very important. It's also very important to have this be accessed by a variety of people. It has to be from the people with insurance all the way down to the folks who don't. I've established a nonprofit that I have on hold right now, but it's called the Migraine Free Foundation. But it will be implemented to help support those people who have financial hardships. It'll be there to help with research and writing, and then marketing and branding, and just converting this thought in the medical community over to understanding that this is one of the ways to get rid of migraine headache. Diverse minds, diverse thinking, a diverse set of patients to examine to see if there are any persons who have migraines more so than others. And when you look at it being a nasal problem, noses are different shapes and sizes, and so they're more apt to be injured based on the size that they are. And I've kind of thought about that as being a possibility of why a certain group might have more migraines than others. And then you look at people like the athletes who play in the NBA or the NFL or even college football or soccer, kids in soccer. They're going to be more at risk of having these nasal injuries that lead to the nasal problem than the headaches and the migraines.
Great. Well, hearing your story and learning more about the work that you've done, it's quite apparent that you've had a truly unique professional journey. What are some of the lessons that you've learned or practical advice that you might have for peers or maybe the next generation of medical entrepreneurs who are just starting to come up? Tell us more about the process you followed as a physician looking to commercialize an idea, since that is a completely different world. And that can ultimately help someone in a similar situation.
Yes, I think first and foremost, as a physician, as a medical student, you need to learn the foundation of what there is to learn in medical school first. And I did that. I learned about migraines then, but then I also had to learn about my ENT and my facial plastic surgery, and I had to know it inside out. So that sets the foundation. Once you have the foundation set, then you have to be very curious and very observant, where you're doing things that you were taught. You're observing the response of the patients, and you're remembering or writing that down, and you see if you can replicate that. And over the course of a career, I've seen so many things now that really I make light of and I make it sound very easy. But when I really step back and think about what I'm doing, it's taken 30 years for me to get to this point. I can ask people where they hurt and know where in the nose the origin is coming from at this point. And there's so much more to do. There's mapping I'll have to do inside the nose saying, okay, if this is irritated here, this is what you get. If it's irritated at that point, this is what you get. So I know that's coming in the future. I can just see that. So you have to have the foundation. You have to be curious. You must be observant. And then you have to listen to your patient. You have to listen to your patients because your patients will tell you. Most oftentimes, you should have a general idea of what's going on based on what your patients tell you. So you have to do that. You then cultivate your ideas. You then have to gain your experience. You have to share your thoughts and ideas with others who have the same innovative thought patterns that you have. And then you have to connect with people who can make things happen. I mentioned the perfect investor. That's what I'm looking for because this is an area that I'm not familiar with. Now we're going from practicing medicine into more of a commercialized franchise business model, if you will. And so that's different. But, I got through medical school, so I can learn another area too. And I can also get people who are experts in that area. I think what you do is you just surround yourself with very good people who can help you execute the plan that you have in mind. I think that's critical. You can't do it all.
Oh, that's such a good point. Well, you've highlighted the importance of curiosity, persistence, observation, empathetic listening, and these are all traits of an ideal physician. And yet, these are not things that happen overnight. So these are really valuable insights that I think anybody can take and learn and grow from. So let's get into the tech that helping to evolve the ENT space that you're in. There's several notable devices that are FDA cleared to treat migraines right now, devices such as the Cephally, the Nerivio, the Relivion MG system, and GammaCore. GoodRx published an interesting blog on the topic, which we'll link to as well. But sticking to this theme, tell us your thoughts on how medical devices can work alongside clinical procedures in the quest for healthier outcomes across a range of patients. And that may ultimately lead into a discussion around personalized medicine. So just tell us your thought here and also what's in store for the future and how will the space continue to evolve? What challenges, risks, or potential dangers do you foresee needing to be addressed along the way?
Very good question. I think that these electrical devices, the gadgets that you named, are electrical devices that help to override that pain sensation by stimulating other nerves in order to achieve relief. I think those devices are very good. They fill a void. And when I say a void, I mean, speaking from my standpoint, I have to reiterate that I'm a root cause guy. I like to look for the root cause of things and correct that to achieve the result. However, my success rate is 90%. So there's some people who I just can't help for whatever reason. And those people may benefit from devices such as these. Also, you have to remember there's some people who don't want surgery. There's some people who cannot have surgery. They're too sick or they might have some medical problem where they just can't have a surgery that I perform. So those devices would be excellent for those folks too. The elderly might be good to have this device, again, if they didn't want to elect to have surgery or could not have surgery. But devices, they do fill a void and they are very much needed. And when they work hand in hand with medical procedures, I would imagine can certainly help with increasing the success rate of eliminating not only migraines, but lots of other diseases. So they're very, very important. As far as the future is concerned, from my standpoint and what I do, I certainly need to spread the word about what I do and expand the knowledge and train to get people to understand my aspect of it. When you look at the devices and things in combination with medical procedures like I do, I certainly see an enhancement. We have in our practice of ENT right now, we use balloon sinuplasty, which of course was derived from a cardiologist needed sinus surgery and said, there's got to be a better way, than you having to just bite and open up all my sinuses. There's got to be a better way. Sinuses have to drain from somewhere. So he got together with the ENT and they devised this balloon sinuplasty. And it's the best thing we could have ever had, where we just maintain normal anatomy, but we enlarge the drainage areas of those sinuses to keep it intact. So that's a demonstration of how technology worked to help benefit. Now ENTs, that's all we do, balloon sinuplasty is very instrumental in what we do when you're a sinus surgeon. So I can see things like that coming about where you're refining some of the tools we use, because again, the nose is very sensitive and delicate. And I think that needs to be stressed in ENT because you can create problems if you aren't delicate and sensitive. So the instruments maybe need to be more fine and more elegant so that we can perform these procedures. And these are just basic things that I'm thinking of that can be done to help improve outcomes. We have shavers with the little spinning cutting devices that suck up polyps and things like that. Those are great devices that were developed in ENT. So I can see some advancements being made on that type of thing. Also, with the navigation systems that we use to outline and be more precise with the anatomy of the sinuses and the nose, devices and research to help us determine how much of the turbinates should actually be reduced and what is too much. What is the exact amount to help someone breathe better and feel better? Some of the dangers, money is the root of all evil, they say. And of course, if you had somebody that really wasn't worried so much about the outcomes, but just making money based on a certain technology or device, then you certainly could have someone out there who has the resources to market it to such an extent that you have people believing it. And as they believe more, they try it more, and it may not be the best for them. That could be some of the dangers. The medical field has been the last great bastion for business people to come in and take advantage of. And so that's always lurking out there. And I think it's prudent for the leaders in medicine to have their fingers on the pulse so that they can identify those things and help root it out when they see it. I think that's going to be some of the best advice I can give regarding that, because in the end, we want to help our patients, not to hurt our patient. And we want the data to be real data, not made up data, which can happen in some cases as well. So that's my take on that.
Yeah, great points. There's so many opportunities, but also pitfalls if things are not done carefully and done with the patient in mind. So thank you for those valuable insights. And now sticking to that theme of technology and devices, here at TechLink Health, we've highlighted that enhanced access to technologies can play a key role for companies and corporations that are looking to improve employee well-being and performance. So let's talk about this more and make the connection between migraines within the workforce and increased rates of absenteeism and even decreased performance. In fact, according to the Migraine Research Foundation, more than 157 million workdays are lost each year in the US due to migraines. And that results in an estimated $13 billion in lost productivity. And by some accounts, this migraine related productivity loss is even higher. For example, the American Migraine Foundation estimates it as high as $61 billion. And that's not to mention the personal costs, relationships, and other lost opportunities. So, what are your thoughts here, and what have you seen based on your experience?
Well, I can tell you that migraine is the number 2 disability behind back pain. So we'll start there. It's pretty big. I can also tell you that I know one study that the University of Michigan did in Bank One in Chicago, where they found that they extrapolated the data as far as the salaries of the employees. And I think almost 20% of the employees had a history of migraine. And they extrapolated it out and figured that Bank One had lost a total of $21 million due to absenteeism and another $24 million due to poor productivity when people were at work. So that's just one bank, one big corporation with lots of employees. And you can just estimate that the 13% of the population has a diagnosis of migraine, and another 5-10% might have a history of chronic headache. That's a lot of people. And so these people are going to be not performing well at work because they're fatigued. They're not sleeping well at night. They're sleep deprived. After that goes on for weeks and weeks and weeks at a time, sometimes years at a time. They're missing work. They're getting fired. Some are disabled and cannot work. So then they have to depend on the social system to help them out. So the economic burden is huge when you think about all the corporations that are out there that are just simply losing money every day. And the solution to that, in my mind, is we get to the point where you screen your employees who have this history of migraine and chronic headache by getting a CT scan of the sinuses. And you have those sinuses read, I guess by me right now, but by my colleague that I've trained. And you identify those that have these abnormalities and you fix them. And with very little effort, these corporations can recoup all that revenue that they're losing by just identifying the patients and having them fixed. The insurance companies who they're losing lots of money with people who are going to the emergency rooms more often. They go to the doctor more often. They use more medications than regular people. And the families that have a migraineur in the family, they spend upwards of $4,700 more per year than a family that does not have a sufferer. And so it has a huge economic burden that trickles down from the family into the workplace and is a huge burden. So I'm hoping to put a dent in that at some point where everybody's functioning as best they can, migraine free, and corporations are getting their work done that they're looking to get done from their employees.
Those are some really important numbers. And I want to highlight what you said about the amount of money that a family would lose simply by having a family member with migraine, $4,700 a year.
4,700, yeah. And they see the doctor 70% more than an average person. So, they're always going to the doctor. They're going to get their massage. They're going to get their acupuncture. They're going to get their medications, and then they can't afford the medication. Some of those medications are $1,000 a month for medicine. I don't even want to pay that much for some medicine. But I guess if I had a migraine, I would. But then they only limit the amount that they can get, and so then they're desperate, and they really are. That's the term. These people become desperate, and they lose hope, and that's a sad way to live. It hurts me when I hear these stories because I don't get migraines. I just don't. But it hurts me to hear how they suffer the way they do. But I'm happy to know that I found a way to help them, and that gives me joy.
Yeah, that's fantastic. And I think if anyone has ever experienced a migraine or seen somebody suffering from one, it really can't overstate the pain and the suffering and the way that that interferes with just normal everyday life. So thank you for sharing those insights. Really valuable. And in the past on the podcast, we've also started conversations around health tech and sport. And for example, we featured devices such as the NeuroFlex device, which is a technology targeted to track and detect brain injuries, even by the courtside or at the site of the activity. So, as a former collegiate athlete turned physician, tell us about how sports has helped to shape your practice and what might be in store for the future when it comes to leveraging your innovations within that sports arena, so to speak.
Yeah, that's a very good question, and I'm glad you asked. Yes, I played football in high school and college, and again, that's a contact sport. And being a contact sport, you're more apt to get your nose injured. If you look at NFL players, both current and former players, they suffer from migraine and chronic headache at a higher rate than the general population. They have sleep apnea at a higher rate than the general population as well. And nobody has ever, we get exams, our physical exams every year, but nobody ever asked me how well I breathe through my nose. And the nose is the most efficient way to breathe. And as a football player wearing a mouthpiece, you certainly want to breathe well through your nose because you have the mouthpiece in. So, with that being said, I think there's a void there, and there's an area that has a need. I've been talking to some NFL executives, NBA people, because they're having these high level athletes work with their strength and conditioning coaches, and they're achieving these high levels of performance. But until you know if their noses are normal, they're not as good as they could be, as good as they are. Let's take a couple of people, for example. Patrick Mahomes, the quarterback, Super Bowl winning quarterback for the Kansas City Chiefs. He gets teased often because of his voice. Well, my expertise in ENT tells me his voice is that way because his nose is blocked. And if his nose is blocked, he's not sleeping well. He's waking up fatigued. He's having a runny nose, postnasal drainage, dry mouth. I can go on and on. And yet you're paying him $500 million. And he's excellent, don't get me wrong. But he's not as good as he could be because his nose isn't open. So that's one example to think about. And then you have all these other high-level athletes. They should all be screened. NBA, soccer, track and field, the upcoming Olympians going over to Paris. What would 5% difference in breathing through your nose or 10% difference breathing through your nose mean for you? If you get more oxygen to your brain, more oxygen to your muscles, you're resting better at night, you have more energy during the daytime, so you practice harder, you get better, you get stronger, you recover faster, okay? And so you perform better. And that might be the difference. That percentage I'm talking about might be the difference between you not going to the Olympics and winning a gold medal. So this needs to be implemented. It's so simple. Breathing is fundamental to athletic performance, peak athletic performance. It's so simple and fundamental that we don't think about it. Nobody's doing it. So what I want to do is implement a screening program for colleges, high schools you could do, because this is going to increase the performance of all athletes in all areas that require breathing to perform. And so I think that's the next level. So that's how I want to implement what I do to help athletes in sports. Nasal airway obstruction, I always stress this upon my students that come and shadow me. When you know the anatomy, you know the function, and you understand, well, what does nasal airway obstruction do to people? Well, it can cause a runny nose. It can cause the headaches. It can cause migraine. It can cause postnasal drainage. It can cause a dry mouth if you can't breathe through your nose at night when you're sleeping, a sore throat, sore mouth. But it can also cause intermittent dizziness, intermittent ringing in the ears, intermittent muffled hearing. A lot of times those people get labeled as having Meniere's disease when all it is eustachian tube dysfunction secondary to the nose being blocked. Okay? That's where I always say, you have to go back to the root cause. Before I label you with Meniere's disease, let me check your septum. Let me check your turbinate or your adenoid. Huge. Because we can reduce or remove those things, you breathe better. The intermittent hearing loss goes away. The muffled hearing, the water sensation, the ringing, the dizziness, it goes away. But you have to understand that in that great detail to know that. And a lot of times we miss that. We miss that. And so, not to mention sleep apnea, that's another thing. Sleep apnea, you're holding your breath at night, several times at night. So you're becoming sleep deprived, but this goes on for years. And so now it's chronic sleep deprivation. You have people driving semi trucks. You have people working on machinery. You have these people doing all these complex things and they're tired. And that's where the mistakes comes in and the injuries come in. And I think it's very important for us to understand before you put a CPAP mask on a sleep apnea patient, you have to know if the nose is open to receive it. If it is, the people feel suffocated, they don't use it, and they're back to square one. So you have non-compliant. So again, looking at the root cause in every sleep apnea patient, what I found is I have done nasal surgery on them to correct the deviated septum or trim their turbinates and also clip the uvula. The uvula, the little worm in the back of your throat. As you snore, it stretches, it gets longer and longer, and you feel like there's a flap in the back of your throat. Well, when I do those things, I've gotten people off CPAP. Why? Because the nose is functioning normal and the throat is functioning normal. Those are the two airways that you have. Those are the two things that contribute to sleep apnea. And so we have devices now that are being promoted to use. Those are good in people who, if their noses are open and their throat is normal and they have sleep apnea, I say yes. But until that, you need to fix the root cause before you jump to device, CPAP mask, BiPAP mask, Inspire, all that stuff. It's all good for the right indication.
These are such important points. As a cardiologist, that was a struggle, getting people to use their CPAP. It either was something that really worked great or they absolutely couldn't deal with it. And I do think that we overlook the nose. We kind of
You
just take it
do.
for granted, you
You're
know.
putting a mask on the nose to push air into it, and nobody said, "Oh, is the nose open?" Oh, I don't know. It's like putting a water hose on a faucet. You turn the faucet on, but the water hose has a little concrete in it that was left over from the last time but it's so simple. We just miss it. But you shouldn't miss that. That's fundamental, making sure the anatomy looks normal. Once the anatomy is normal, we see how they do. If they still snoring and have sleep apnea, now we put a CPAP mask on and they go on about their business. Because now the pressure's lower, they can tolerate it, and it's comfortable.
And as a result, then they have a lower risk of having all the complications of sleep apnea, which we know,
Oh my goodness,
heart
yeah.
as well as
Heart.
the brain. And
Yes.
yeah. So yeah, I can see your point of how important it is that we pay more attention to our nose and what's going on in the nose and how that can affect the health of the whole body.
Exactly.
So, in closing, any final advice that you'd like to share? And also, how can listeners continue to stay connected to the innovations happening in the ENT space? And along those lines, we're always interested in topical book recommendations or other types of content on the subject. And I'd love to hear your thoughts there.
Well, as far as a book on the subject, I've written a book called The Migraine Imposter. I have it sitting at a publisher right now to be printed because it's old information. I wrote this book, I don't know, 12, 13 years ago. So what I've done is I've written a nice addendum saying that I know far more now than I knew then. And the title is The Migraine Imposter, but I'm actually curing migraines is essentially what the addendum is. But so be patient and look for that to come out, The Migraine Imposter, as a resource for you. But there are other resources too that I think are very good for people to just stay on top of things. ShareCare is a website you might check out. WebMD is very good. Those online medical searches with those two are good. And I think people need to be their own medical app. They need to understand what's going on. They need to have the doctors explain to them where they clearly understand what it is they have and what it is needs to be done to correct it. And then ask some intelligent questions, but certainly be their own advocate. I think when you're looking for a doctor, of course, a board certified physician is always good to have. But then now we have social media and reviews that you can look at to help you make a decision on who it is you want to go see, and that's very, very important. Social media, Instagram, Facebook. I know on my Facebook page, I have dozens and dozens of video testimonials of people who I've treated telling their story because I know that those videos can help somebody else who's out there wondering, why am I hurting so much? I think all those are good things to have and good things to seek when you're looking for a top-notch physician. And if you happen to know some nurses and surgical nurses and you can talk to them about who has the best hands, who does the best work, that sort of thing, it's always good. I have countless patients come to me and said they found me on the insurance book, but then they read the reviews and then they looked on the website. So they do their homework. And I'm always happy to hear that because that means you can get further down the line of getting to know each other. They already know who you are. So now we can get down to the root cause of why you're here and they trust you, that sort of thing. It's always good.
Wonderful. Well, we will link to those resources and we'll look forward to your book, The Migraine Imposter, coming out soon, I
Yep.
hope.
There you go. Yeah, soon. Do I need to give my website or anything for people to get in
Yeah,
touch with me?
let's give your website and we'll also link to it in the show notes.
Great. Well, the website is kevinsmithmd.com. The Facebook page is Smith Center, Otolaryngology, and it has dozens of video testimonies, just great stories from people with all type of migraines and their stories about how they found me and how they're doing afterward. And then my Instagram is at Smith Center. The phone number is always good too. You can always call us at 713-795-0600.
Fantastic. And we will link to all of those in the show notes. So my guest today has been Dr. Kevin Smith. Thank you so much for joining us today. This was so informative and fascinating, and I look forward to learning more about your program.
Thank you very much for having me. I really enjoyed it. Thank you.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.